Medical disclaimer. All the content shown on the Harry Sopanos channel is created for information purposes only, based on personal opinions of the host. The channel contains health and medical related material or discussions based on the best research science that I'm aware of and my personal interpretation and understanding of the past or current research literature, and should not be viewed as medical advice. Any recommended dietary regime, supplement use, or dosing is based on my personal usage and opinion, and should not be viewed as medical advice or nutritional advice, and is for information purposes only. If you're considering applying any of this information, first seek professional advice before doing so. None of the research information or opinions presented are meant as medical advice or to be used to diagnose yourself. Always seek medical advice from a physician or other qualified health provider. If you think you may have a medical emergency, call your doctor, go to an emergency department, or call an ambulance immediately. The channel is not intended in any way as a diagnostic source for an acute condition. G'day guys. This is intended to just sort of cover the issue of that a lot of people have been sort of contacting me, emailing me, or leaving me comments, and just asking me, what should I do, Harry? What sort of jab should I take, or should I take it? Shouldn't I take it? All these things. Let me just be quite frank and clear. It's your body. I can't tell you. No one can tell you what to do. All I can do, like others, is provide you with information. What you do with that information is up to you. I don't own your body. I own this body, and I decide what goes into this body and what doesn't, in terms of nutrition, in terms of vaccines, in terms of anything. So let me just make that quite clear and emphatic. All I do is basically provide the best information that I can come up with, that I can find through my research. Provide the most plausible, mechanisms for certain things. Explain and actually point out quite emphatically when I'm speculating on certain things, even when it comes to risk, because we either don't have enough research or we basically can't emphatically say, with certainty that there seems to be a relationship with something, but it doesn't mean that, that's causal. So let's clearly define some of these parameters. I know a lot of people are basically stressing currently due to employment reasons, due to a whole lot of raft of reasons, family, work colleagues, pressures, just general pressures, anxieties, the need to travel, all sorts of issues that have arisen in people's lives. I'm a bit disappointed that the Novavax sort of availability is still basically there's delays. It's unclear exactly all the reasons for the delays, and why it's been pushed to the latter part of this year in some countries and early next year in others. And it seems even in Australia it's going to be probably next year rather than this year. If we get lucky, it may be towards the end of this year, but it's still very unclear. The minister last time sort of indicated that it may be either towards the end of this year or early next year. Not very clear. They put their order in a bit late in Australia. So there's a lot of ambiguity with all this sort of stuff. And I know a lot of people have been asking me and all that, but I don't know. There's a lot of people speculating out there, but the reality is none of us know until the actual government makes the announcements in any jurisdiction or the medical authorities, you can call them and find out and try and actually ascertain at what stage. In a federal system like Australia or the US, and even the sort of a quasi-federal system that exists even in the UK as an example, you've got a situation where the local authorities will probably know more about the dispensing of specific things than the federal authorities, maybe still waiting for certain approval committees to basically finalise their sort of stuff. So it's very unclear exactly where we're at with Novavax. And the current options are the mRNA type and viral vector type vaccines. That's all that's available at the moment, and they vary from country to country which ones are available. And it's just basically very limited in some areas where some countries are only providing one of them or two of them, very limited choices. So it's a hard option. I understand. I sympathise with people that are in a difficult spot in this regard. I mean, if I'm sort of pressured, I may have to move permanently working from home. So until sort of government brings in legislation making it compulsory for everyone, not only frontline people, that's probably going to be my option: vitamin D and working from home. If push comes to shove, so to speak. I can't make other people's choices. You've got to make your own choices. You've got to live with those consequences. I can only provide you the information and the potential risks. The reality is, these are all risks. Like anything in life, crossing the road is a risk. I can't basically make those choices for you. You guys have to make them on your own. I'm just going to share my screen for a sec. Okay. So this is the cancer.net. So sort of they've got a journal and stuff like that. I'll give you a bit of a background so you know what this organisation is all about. So this is basically an organisation that's got 45,000 members. They consider themselves a leader in advancing cancer care. The Americans and are sort of affiliated to the American Society of Clinical Oncology. So, so this is basically tied up with one of the major, so it's OSCO patient information website. So it's their patient information website. So this is the official stuff. So we're only looking at official stuff, because the reality is we've got limited research when it comes to these sort of things. People have been asking me, where's your proof? Where's your that and this? The reality is that we don't have clinical studies, even in the oncology area, sufficient, like, that silver bullet that some people are asking for. I can't provide you that because it doesn't exist. A lot of the stuff is case studies. That means where doctors are basically seeing certain types of reactions, certain types. I mean, let's be honest. Do you think that the pharmaceutical companies that are producing these products are going to basically do studies to show the deleterious effects of these products? I mean, wake up to yourselves. No, they're not. All you're going to do is get clinicians, frontline clinicians, doctors that are actually basically are dealing with these people and are actually seeing these effects. And that's pretty much how it comes. Now, this goes back to one of their editorials, which is for the cancer.net editorial board, and this is the 5th of 2019. But I'll just go through in terms of, these are the side effects of immunotherapy.
So when we're talking about immunotherapy, we're talking about, you know, whether it's a viral vector one, a DNA one, whether it's an mRNA one and all that sort of stuff. So they've got, like, you know, common immunotherapy side effects like skin reactions, skin redness, blistering, dryness, common reactions. They've got basically skin sensitivity to sunlight. A lot of scratching can break the skin and stuff like that. It actually weakens the collagen, it seems, as well, for that to be, inflammation around the nails. These can affect when people are grooming and dressing and stuff like that. Obviously, these people are being injected multiple times with these things as part of the therapy, so they're getting quite substantially higher doses and all that. So it's probably the reason why. But even some people tend to be more susceptible even with less. So it varies. It's genetics. It's all sorts of so many varied variables. It's really hard to know. The problem is, because they haven't done like long-term studies, which we'll probably get through the COVID period, eventually we will get like long-term 5-7 years. And in 5 or 7 years from now, we will know about a lot of this sort of stuff. Not only the acute stuff, a lot of this is acute stuff, but also like long-term stuff as well. So, the possible muscle aches, sounds like a statin, shortness of breath, trouble breathing. Well, that's not a good thing. Swelling of legs, edema, definitely not a nice thing. Is it inducing? I'm not saying it's inducing diabetes, but it seems to have certain symptoms very similar. Sinus congestion, headaches. There's both severe and mild. Weight gain. A lot of these sort of things do have these sort of side effects. And retaining fluids, diarrhea, hormone changes. When we're talking about hormone change, we're talking about autoimmunity, like including hypothyroidism. So basically, these can induce hypothyroidism type effects, coughs, and they basically say, some of these sort of things important about getting hydration somewhere here, keeping any fluids down, blah, 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 but they don't really have any proper solutions typical of the medical system. What you need to know about immunotherapy side effects. This is another one of theirs, and they've sort of looking at fatigue. Sort of, I don't know whether it's going to be causing any fibromyalgia in people. It's very hard to say about these sort of things. Diarrhea, fever, shortness of breath, rashes, blisters, covering less than 10% of the body, nausea, vomiting, itching, headaches, weight loss, difficulty falling or staying asleep, decreased appetite. The dangerous side effects. There are dangerous side effects with these sort of things. Severe side effects can be life-threatening. It's not me saying it. These are the people working in oncology that are saying it. That severe side effects because of these type of can be. They may occur right away, acute, that means acute immediately, or up to 2 years after the treatment ends. So taking one of these, because remember in the past, we would basically do a 5 to 7 year study, trials. We would do animal trials, we would do a whole lot of them, eventually human trials, and we would basically investigate to see what happens to these people over a certain time. Identify groups that are vulnerable, specific genetics for those groups, and a whole lot of other factors. We really haven't done that because these were basically fast-tracked. These were basically emergency rules that apply, and basically we're not looking at the side effects. We're just saying, well, we're going to wear some of the side effects. And as I've said before, it's like Russian roulette. Do you want to play Russian roulette? It's up to you. I can't make that choice for you. And neither should they be telling you, making that choice for you. especially younger people that are a lot less vulnerable and all that, should not be basically being pressured to be taking something like this. That's unacceptable. High risk groups, if you want to vaccinate high risk groups, fine, if that's what your policy is. But there's no justification for basically putting at risk younger people that are basically just going to get mild flu-like symptoms. That's just completely unacceptable in my book. But that's my personal opinion. You may disagree. That's yours, your right to disagree with me. But I'm looking at basically the potential risks up to 2 years. And who knows? This is up to 2 years based on the oncology related sort of stuff. Could basically there be other problems in other areas for others? I mean, the previous video that I talked about showed a high concentration in the ovaries. We haven't seen something in the males. You know, I would like to know whether my balls would be at risk. You know, I mean, it may not be important for women, but it's definitely friggin' important for us males. There's been no research there. And it's a bit unfortunate, the reality that in some areas, men get discriminated in research, and in some areas, women get discriminated, you know, in these sort of cases, because there's, you know, the pregnancy, birthing, and all that sort of stuff. And that's why they probably looked into these areas, where for males, you know, they see it as less important. So even though we do provide half the chromosomes, but anyway, that is an issue in itself. If you are treated with an immune checkpoint inhibitor, the side effects, they say side effects, inflammation of the lungs, pneumonitis. So, well, we know that something like that can kill, you know, does kill, pneumonia does kill people. So that's a side effect, and that's from the vaccine, okay? New or worsening cough, shortness of breath, chest pain. Side effects, inflammation of the liver, yellow skin jaundice, severe nausea, vomiting, pain. So these are sort of side effects that you can actually have, you know, colitis. So hormone glands, thyroid, pituitary, adrenal glands, pancreas, inflammation of the brain, neuropathy, meningitis, encephalitis. So it goes on and on. These are things that actually have been seen basically in this area. These are well-recognized risks: kidney problems, including kidney failure, complicated skin reactions, severe infections, eye problems, severe infusion reactions, you know, blah, blah, blah. I'm not trying to scare people. All I'm trying to do is provide you. This is official stuff. This is not Harry Sopanos saying this. This is basically an organization that's connected. If you remember what I said, OSCA, the American Society of Clinical Oncology. This is information, you know, it's the voice of world cancer physicians. This is for their patients. They're telling them these are the risks when you're using this technology. Okay? This is not me saying it. This is them saying it. Okay? Let's be quite clear. This is a recent study on, thrombosis, on basically clotting associated with COVID-19 infection. That's an issue in itself. And I've told you how to protect yourself. Vitamin D, vitamin D. I cannot stress how much. And quite high doses very early, and maintain a good status, so it doesn't get to this level. Also, a species appropriate diet will basically guarantee that your blood, that you don't have platelet aggregation because you're not engaging the Randall cycle and pushing up clotting factors. You know, being on a species appropriate diet is protective in these times. And basically, PF4, autoimmunity, heparin-induced thrombocytopenia. And this is an autoimmune reaction to SARS-2. And this is also in regards to the vaccination, talking about. I'm not going to go into it now because I'll provide the links and people can look at it. Otherwise, this video will blow out to autoimmunity of PF4 contributes to thrombocytopenia, which occasionally occurs during COVID-19 or after vaccination with adenoviral vector-based vaccines based on SARS-CoV-2. So even the not only the other ones, the mRNA ones, but even the adeno ones, also they can create some of these issues as well, because they're all basically running little programs of replication in your cells. Remember, that's the problem. That's the difference between traditional vaccines and these new ones that have come from oncology. The problem is the companies that produce these products don't do the studies. They don't do the follow-up. They don't look at this. And basically, you need oncologists amongst themselves, talking amongst themselves and letting each other know what the side effects is and what to look out for. And if you have any of these side effects, get to a medical facility as fast as possible. And I would recommend that if you've basically taken something like this out of pressure or whatever, maintain a good vitamin D status, use a low dose for aspirin. And if you can get ivermectin to clear out the system, I would get ivermectin to clear out the system. Anyway, we'll touch that a bit later on. This is another one. This is one of their studies where they're talking about a case control study on autoimmunity and blah, 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 the 19 vaccines. And they go, and they're trying to say, well, the ratios and the symptoms of multiple sclerosis and all these other autoimmunities, that they're very low. Well, you know what? There hasn't been a lot of recording. That's why they're very low, because, you know, some countries are doing more recording, some countries are not. Some physicians are just not recording the side effects. They're just putting them down as just general side effects. So what do you do? And that's why you're getting these sort of Mickey Mouse studies that are just reviewing stuff, but they don't really tell you much. This is from the UK site. And this is basically the Moderna. So it's called the Spikevax, the Moderna name in the UK. And if we go down here, it is not recommended for children under the age of 12. This is the AstraZeneca. And remember, they're actually talking about now actually giving it to kids, you know. So they're covering breastfeeding and all that, not to be, you know. So let's just go down. Possible side effects: feeling faint or lightheaded. Wonderful. Don't get in a car. Changes in your heartbeat. That doesn't sound good. Shortness of breath, wheezing, swelling of your lips. Yes, I see. You don't even have to go and do a Botox. Just take Moderna. You'll get you could get a free service. Swelling of the face, tongue or throat, hives or rashes, nausea and vomiting, stomach pain. Very common. Swelling, tenderness, headaches, nausea, vomiting, blah, 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 and all that. Look, even some traditional vaccines will cause that. That's normal. Rashes, that's pretty common as well. Itching and stuff like that. That can actually happen even with common ones, you know, but these are rare ones. Temporary one-side facial drooping, Bell's palsy. So if you've got the genes, this potentially could push you over make make this possibly happen, where you end up with part of your face drooping, a bit like somebody has like a stroke victim. Not a good look if you're a young person. Swelling of the face, very dizziness, decreased sense of touch or sensation. Not a good thing either. Is that hot? I'm just joking. You know what I mean? You've got to be a bit facetious with these things. Frequency unknown, severe allergic reaction, breathing difficulties, anaphylaxis. That's a risk with this one, with Moderna. Didn't even realize that it potentially could cause anaphylaxis. There you go. I learned something from the official site as well. Reaction of increased sensitivity or intolerance to by the immune system, hypersensitivity. It doesn't cause autoimmunity or any problems with the immune system. Yeah, and this is the official stuff. Now, as I said, this may not affect you, or it may affect you in 2 years' time, like some of those other patients. As I said, I don't know. All I can do is tell you about the risks. The choice and decision is up to you, not me. Inflammation of the heart muscle. I've had that due to basically those beautiful seed oils and an operation to boot after that. I think I'll give that a miss. Inflammation of the lining outside the heart. Oh, fantastic. Which can result in breathlessness. Oh, great. Palpitations or chest pain. That's all I need. I've missed those sort of symptoms. That was a decade ago. Damn, I'm neglecting myself. Anyway, that's that one. We'll go to the Pfizer one. So there's the Pfizer one. They also recommend not younger than 12. And they're actually now in Australia and a few other countries are actually talking about actually allowing these to younger than 12. I mean, they shouldn't even be allowed younger than 18 because the immune system is still developing. I mean, God almighty. What do you say? What do you say? Anyway, let's move on. Very common. Pain at the injection, tiredness, headaches, muscle pain. These are standard. Itchiness, standard. Redness, nausea. They're usually standard. I mean, even when you actually get the common cold or a virus or whatever, you can have some of these symptoms. Obviously, if you've got a good vitamin D status, you'll probably not have these symptoms at all. So, you know, you'll do much better. Uncommon, enlarged lymph nodes. That's all I need is to just worsen my lymphatic system. Yes, where all my immune system sort of, and also my fats that come in with the chylomicrons go through. Yes, that's all I need to basically inflame the lymphatic system. Feeling unwell, arm pain, insomnia. Yes, that's all I need. Never to sleep again. Just joking. And itchiness, allergic reaction. Yep. Severe allergic reaction, inflammation of the heart, like the other one. Well, it's an mRNA like a Moderna, so I'm not surprised that it has similar extensive swelling of the vaccinated limb, swelling of the face. Swelling of the face may occur in patients who have had facial cosmetic injections, so it could actually make it worse. Yes. So yeah, so there's a whole lot of similar type of symptoms. Now, let's take a look at the AstraZeneca. Now, do they have one? So they have the major warnings, which has to do with basically the clotting factors, because that's one of the big ones. That's why I say to people, you probably need to be on for about 6 months. It usually, for most people, the majority of the immune system should clear out the majority of this within 6 months. So you're probably looking at a low dose aspirin. It's not something that I recommend regularly, but if somebody's taken AstraZeneca, then they may have to for the next 6 months because they don't know what genetics they've got in terms of clotting factors. There's another thing you could do as well to reduce clotting factors. Earth yourself. You could basically take, L-citrulline, which is really important in that regard. So you could do those sort of things. It's a vasodilator. Taurine as well will help. That also plays that sort of role. And anyway, blood disorders, extreme rare case of blood clots with a very low blood platelet, thrombosis, and thrombocytopenia syndrome. Severe headaches, unusual headaches, blurred vision, confusion, difficulty with speech, sounds like a stroke, weakness, drowsiness, and seizures, rash that looks like a small bruises, bleeding under the skin beyond the injection site, shortness of breath, chest pain, leg swelling, leg pain, persistent abdominal pain. So there's quite a few issues there. And this is not recommended for children under 18. And in Australia, they're actually talking about under 18. And I don't know whether they've actually recommended it yet. I haven't actually looked at the latest stuff. I'm just sick and tired of looking at the bullshit on the TV. Anyway, the Johnson & Johnson one. So if you're in the US, definitely give this one a miss. Is linked to neurological disorders in extreme rare cases. Are you the extreme rare case? You don't know unless you've checked your genetics. There have been around 100 people reports of people developing Guillain-Barré syndrome. Fuck, I hate these words. Can't they use simple words? Anyway, this one is a rare neurological disorder in which the body's immune system mistakenly attacks part of the peripheral nervous system, the network of nerves located outside the brain and the spinal cord. Conditions in which the immune system attacks the nerves, the conditions may be triggered by an acute bacterial or viral infection. mRNA and viral vector stuff. Does it surprise me? No. Symptoms start as weakness and tingling in the feet and legs and spread to the upper body. Paralysis can occur. Fantastic. Special blood treatments, plasma exchange, and immunoglobulin therapy can relieve symptoms. Physiotherapy is required. Yes, that's all I need is basically a whole lot of additional interventions. Pretty much these are a lot of the actual sort of issues and all that. This is a standard dose of ivermectin. So if somebody was to get it, they're looking at basically what they recommend is the sort of, where is it? So 200 as a standard dose, 200 micrograms. So if somebody was basically trying to remember the conversion now. It's 0.2. That's right. It's 0.2 of a per kilo, 0.2 of a milligram per kilo body weight. So let's say somebody's 70 kilos, which is 154 pounds. It's about a dose of 14. So I usually talk about 12 milligrams because you can get them 12 milligram capsules, and you take those for 5 days in that regard. So if somebody is going to take one of these vaccines, then I would basically be high dosing vitamin D and also be taking at least for the next 5 to 6 days, 12 milligrams of ivermectin. Why? Because it can clear it out of the system much faster and reduce the potential side effects. That's why. Okay. And I would also be taking through that period also of an aspirin, a low dose of aspirin. And I'd be also doing L-citrulline to basically improve vasodilation. I'd do a bit of earthing as well and stuff like that. So these are the sort of things, if you're forced, pressured in some regard to basically go down that path, and where you don't have the option, you're basically told you must take this to hold on to your employment or to travel overseas or whatever maybe your circumstances. I don't have many options for you guys. I mean, if somebody was to put a bullet to my head, I definitely wouldn't take Moderna. I definitely wouldn't take Pfizer. I definitely wouldn't take Johnson & Johnson. If I had to take anything, I'd probably go for the Astra, and I'd make sure that I had high dose vitamin D and ivermectin and basically some of the other low dose aspirin, things of that sort that I'd be looking at. At this stage, I'm not taking anything. I'm just basically doing my vitamin D and stuff like that, and eating a species appropriate diet. I don't know what the future holds in my situation or anyone else's. I hope this has been of some information about the risks, potential long-term risks in 2 years' time. That's all I can. There's not a lot out there. We've got case studies of people sort of after 2 years having really severe symptoms and potentially life-threatening, where people have died. Is that going to be you? I've got no idea. Me or anyone else? No idea. When it comes to these sort of things, all I can do is, speculate, and usually turn around to myself and say, am I willing to take that risk? I'm not, because basically I know that if I maintain a good vitamin D status, this isn't going to kill me. And since it isn't going to kill me, and I want longevity, and I want to live a long, healthy life, I'm not going to basically allow these bastards to basically push me into basically putting my health at risk. I listened to them a long time ago with their recommendations for seed oils and toxic crap like that, and ended up a slab on a table, having my chest ripped open and my heart surgically, fixed. I don't want to go down those sort of path. I've been through the ringer when it comes to the medical system, the modern medical system, and let's say, yes, it doesn't sort of endure a lot of trust in me anymore. It failed me, and it's failed a lot of other people, including many of my subscribers. Personally, unless there is good research for something, and you guys know I did the flu vax, and I got no problems with doing the flu vax, and I've got no problems with doing certain other vaccines, which I have done in the past, even for shingles. which was the one one of the major ones that I've probably done. So I don't have a problem, but I do have a problem with experimental stuff that gets fast-tracked, emergency stuff, hasn't gone through a 5 to 7 year sort of, sufficient examination. And it's a new technology which has never been used in vaccines. mRNA and viral vector technology is new to the vaccine scene. It's not it has nothing to do with traditional vaccine approaches. It comes from the oncology field. And in that field, there is plenty of case studies. People can do their own research if they so desire. And they can find these case studies, or if they have friends who are physicians in the area, they probably can get copies of these case studies, and find out, in detail about some of the lives that were damaged due to these sort of approaches, technologies. The reality is, as I said, life comes with risks. All I can say is I'm not prepared to take these risks. All I can do is provide you with some information to try and mitigate. If you do go down this pathway, then make sure you maintain a good vitamin D status, a low dose aspirin, and definitely, if you're going to take this, take ivermectin. You need to clear it out of your system, because the quicker it actually clears out of the system, the better it'll be for you. That means long COVID type symptoms are less likely, or long-term type of severe conditions or autoimmune conditions, or these severe life-threatening type conditions within the next 2 years are considerably reduced. Based on research that other people have done, and based on some medical people that are basically using some of these techniques currently, the ivermectin vitamin D combination, they seem to be getting good results with long COVID type symptoms. So that's all I can base that if I was recommending something to myself, that's what I would be recommending. But that's all I've got when it comes to that. So I know a lot of people are under pressure. A lot of people are scared. I sympathize with you guys. We're all in the same boat, more or less, to different degrees. I can only provide you the information, the risks, and some potential options that may work. I can't guarantee you this. I can't guarantee you that for your specific genetics, these things will work. Nobody can. But all I can say is that, one thing that I'm certain about, maintaining a good vitamin D status is probably going to be the best thing you can do in this sort of climate, in this sort of risk climate. Beyond that, I've got nothing else, and I can't make the choice for you. I know a lot of people have been asking me, what would you do, Harry? What should I do? I can't make that choice. What I would do is not take it until, the only one that I'm prepared to countenance is, the Novavax, or the Indian one, the new one that is a more traditional type, or some of the other more traditional types. Those are the only ones. On paper, they seem not too bad. But when it comes to anything beyond that, are you prepared to play Russian roulette with your life for the next 2 years? I can't make that choice for you. You've got to make that choice. Anyway, this is for information purpose only. I do not any recommendations or any opinions in regards to what I would do is my personal choice. Whether you basically consider that an option for you. You should take it to your physician. You should basically carefully weigh all the risks and benefits or whatever and make your own choice. I can't make those choices for you. I can only provide you with what the official, what I'm showing you is studies and official stuff that's out there. I'm not showing any other stuff. I'm not making up stuff. I'm not putting forward any sort of crackpot type ideas, like, the graphene and the prions and all these other nonsensical things that people have talked about. I mean, as I've pointed out, just cooking food will create graphene type particles. I mean, get over it. I mean, even the vaccine that I had recently, which was the flu vax, that had graphene in it. I don't give a shit because I eat graphene, in the foods that are cooked. I mean, it's a joke, whoever thinks that that's a problem. So I don't have problems. My body can detox those, the carbon-based things that the body can break very easily, break down with enzymes. It's a non-issue. I don't even know why it even got any traction, but there's plenty of crackpots out there that like to play all these sort of things. It's misdirects as far as I'm concerned. It doesn't help anyone. It doesn't inform anyone. It doesn't basically. What I'm providing you is the official stuff, what officially they are quoting and saying the risks that they see in these fields of oncology where they've used this sort of stuff. And some of the recent studies, like that one, there are plenty of others. I didn't want to bombard this with a whole lot of studies. Basically, this was more to basically discuss the constant emails that I'm getting from a lot of people. What do I do, Harry? Sort of thing. It's a response to that and giving you some information where I've determined, where I've come to my sort of thinking or my own decisions for myself. I've looked at that sort of stuff and a lot of other studies and stuff like that. And I've said to myself, I've looked at Mira, the way she recovered very quickly with the vitamin D. And I'm going, yeah, I'm still young. I'm in my mid-50s. I'm not old. I'm, much healthier now. I'm looking after myself. I've reversed a lot of my ailments. I seem to basically cruise through, even when other people are getting a lot of severe symptoms from the common cold or flu or whatever. And I seem to be very resilient in comparison to them. So species appropriate diet, good vitamin D status seems to be working for all the others. So I think I'm pretty safe with COVID if I maintain that regime for myself. But that's the choice I make. I live with the consequences of all my decisions. And all you can do is live with your consequence, with your decisions. So I hope this was informative for people to understand where I'm coming from and where my opinion is drawn from. What you decide is your business. Your body belongs to you, belongs to no one else. And, look after it. That's all I can say. Anyway, hope you got something out of this, and I will see you next time.